Hello, I'm AARP Senior Advisor and National LGBTQ Liaison, Nicordelai Corte, and I want to welcome you to this important discussion about the coronavirus and efforts to end LGBTQ discrimination. AARP, a nonprofit, nonpartisan member organization, has been working to promote the health and well-being of older Americans for more than 60 years. In the face of the global coronavirus pandemic, AARP is providing information and resources to help older adults and those caring for them. Today is a special LGBTQ Pride Edition, highlighting our continued efforts to learn from national leaders, raise awareness about critical issues, and listen to your questions related to the coronavirus pandemic, and will make sense out of the recent U.S. Supreme Court decision protecting the LGBTQ community from employment discrimination. It's an important conversation if you, a loved one, friend, or neighbor, is LGBTQ or an ally of the LGBTQ community. So please stay with us. If you've participated in one of our teletown halls, you know this is similar to a radio talk show, and you have the opportunity to ask questions live. If you would like to ask a question, press *3 on your telephone to be connected with an AARP staff member who will note your name and question and place you in the queue to ask that question live. To ask your question, please press *3. Hello, if you're just joining us, I'm Nicordelai Corte with AARP, and I want to welcome you to this important discussion about the impact of the global coronavirus pandemic on the LGBTQ community of older adults and federal efforts to end LGBTQ discrimination. We're talking with leading experts and taking your questions live. To ask your question, please press *3. Joining us today is Annise Parker, former Houston mayor and president and CEO of Victory Fund Institute, Glenn Magpantay, executive director of the National Queer Asian Pacific Islander Alliance, Karen Loewy, senior attorney and seniors strategist at Lambda Legal Defense and Education Fund, Diego Sanchez, director of advocacy for PFLAG, Justin Nelson, founder and co-president of the National LGBTQ Chamber of Commerce, and Dr. Irwin Tan, AARP Director of Health and Thought Leadership. We will also be joined by AARP Foundation Litigation Senior Vice President, Bill Rivera. Bill will be our organizer and help facilitate your calls today. AARP is convening this teletown hall to help you access information about the coronavirus and learn about our collective efforts to end LGBTQ discrimination. Now, while we see an important role for AARP in providing information and advocacy related to the coronavirus, you should be aware that the best source of health and medical information is the Centers for Disease Control and Prevention, CDC. They can be reached at cdc.gov/coronavirus. LGBTQ older adults and seniors can also find tips, tools, and resources and all sorts of benefits at aarp.org/pride. That's aarp.org/pride. Now, this event is being recorded, and you can access that recording at aarp.org/coronavirus 24 hours after we wrap up. So let's talk about how AARP is fighting for you. Today, we are talking with experts about what this week's 6-3 U.S. Supreme Court decision on LGBTQ employment discrimination means for the health and financial security of LGBTQ older adults. To ask your question, please press *3. But before we discuss the implications of the recent Supreme Court decision and those implications and what they might have on your community and loved ones, let me just say that these are trying times for many, and AARP is advocating tirelessly for our members and all people age 50 and older during the coronavirus pandemic. First, we fought to ensure that Americans whose primary source of income is Social Security will receive payments of up to $1,200 under the recent economic stimulus package, and they will not have to file any additional paperwork to receive the payment. You can visit aarp.org/coronavirus to use AARP's stimulus payment calculator and estimate the value of your payment. We've also pushed for expanding unemployment insurance benefits as well as paid sick leave and family leave for people who need to take time off to care for themselves or loved ones. While we've been hard at work here in Washington, D.C., AARP representatives across the country are also fighting for you during this public health crisis on issues ranging from virtual visitation in nursing homes, telehealth, paid leave, and more. I want to share just a few examples of that. AARP state offices in Arizona, Missouri, Texas, and West Virginia have fought to protect people from electric, gas, and water disconnections and late payment fees at a time when it's more critical than ever to be able to stay connected to loved ones. Many AARP state offices, including California, Connecticut, Tennessee, and North Carolina, are fighting to ensure that people can retain access to telephone and broadband internet. In places like South Carolina, New Jersey, California, and Wisconsin, AARP is working to ensure that residents have access to information and needed health care. In Maryland, we play an active role on the Caregiving LGBTQIA Advisory Group. And in Florida, we're rolling up our sleeves along with the Orlando LGBTQ Center to make calls to senior centers and assisted living facilities in an attempt to fight social isolation. AARP's Illinois team has also been named to the Chicago Mayor's Task Force on Racial Inequality to help stem the rise of deaths in that city. And in New York, Michigan, and Massachusetts, we're calling for more racial and ethnic data collection, outreach and testing in communities of color, and seeking commitments from leaders to address the underlying issues of hunger, health access, transportation, and more. You know, racial and ethnic minority groups and the LGBTQ community have experienced a long history of discrimination by government, health providers, insurers, and institutions, resulting in lower levels of trust in the healthcare system. The added stress of the potential legalization of employment discrimination on the basis of sexual orientation and gender identity make the days more challenging. These are important issues that our communities are facing, and AARP staff and volunteers are proud to be fighting on them. And speaking of pride, this month is also LGBTQ Pride Month, so I want to recognize the resilience and incredible contributions of our LGBTQ AARP members, allies, volunteers, and older adults across the country who make their voices heard through phone calls, emails, and more on issues that impact us all. Thank you. Thank you very much. Now, on to the SCOTUS decision and what lies ahead for all of us under the rainbow. Earlier this week, AARP Executive Vice President and Chief Advocacy and Engagement Officer Nancy Lamond released a public statement on the U.S. Supreme Court's ruling on Title VII of the Civil Rights Act of 1964 and the Federal Health Department's rollback of key protections under Section 1557 of the Affordable Care Act, ACA. She said, quote, AARP is pleased that the U.S. Supreme Court ruled in favor of protecting LGBTQ employees by interpreting Title VII of the Civil Rights Act of '64 to include sexual orientation and gender identity under the definition of sex. Millions of LGBT workers, including millions of LGBT workers, are safeguarded from employment discrimination under federal law. At the same time, we are disappointed by the recent rollback of key LGBT protections by the Department of Health and Human Services, HHS, which on Friday finalized proposed changes to Section 1557 of the ACA. The policy change, in direct contrast to the Supreme Court ruling, eliminates specific references to sexual orientation and gender identity from non-discrimination requirements, covering state policy planning, Medicaid managed care plans, and more, end quote. This ruling could not have illuminated the financial security and health security risk of the LGBTQ community in this COVID-19 era more clearly. Now, for in-depth analysis, I would like to welcome our first three guests to talk about the SCOTUS decision and its impact on our families, neighbors, and businesses. Please welcome Karen L. Loewy, Senior Counsel and the Seniors Strategist for Lambda Legal, the oldest and largest national legal organization committed to achieving full recognition of the civil rights of lesbians, gay men, bisexual, transgender people, and those with HIV. As Senior Counsel, Loewy handles groundbreaking litigation and supervises attorneys in all areas of Lambda Legal's work, including fighting for recognition of same-sex relationships, battling anti-LGBT discrimination in employment, housing, public accommodations, and healthcare, and securing the rights of LGBT parents. Justin Nelson, co-founder and president of the National LGBT Chamber of Commerce, the business voice of the LGBT community and the largest LGBT economic advocacy and business development organization in the world. NGLCC is the exclusive private sector certifying body for LGBT-owned businesses. In addition to over 50 LGBT affiliate chambers in the United States, representing America's 1.4 million LGBT business owners, NGLCC leads economic development opportunities for over a dozen international affiliates. And Diego Miguel Sanchez. He's Director of Advocacy, Policy, and Partnerships at PFLAG, a native of Augusta, Georgia, and longtime Massachusetts resident. Diego was most recently Senior Policy Advisor to Congressman Barney Frank until the representative's retirement in 2013. Diego made history with that appointment, being the first openly transgender person to work as a senior legislative staff member on Capitol Hill. Welcome to you all. Karen, let's start with you. Many LGBTQ leaders were bracing for a devastating decision on LGBTQ employment protections, potentially made worse by the COVID-19 induced recession. Can you tell us about the Title VII U.S. Supreme Court decision and its ruling on LGBTQ employment discrimination protections? What does it mean for workers, particularly older workers and their employers? And how does this fundamentally change the fight for LGBTQ civil and human rights?
Thanks so much for the opportunity to talk about these things today. It's great to be with all of these august colleagues and partners. This decision by the Supreme Court on Monday is really the culmination of a long march forward in the courts to recognize the equal humanity and dignity of LGBTQ people, and in particular workers. People's surprise is understandable given really the history of discrimination that you've exactly laid out. But those of us who have been toiling in the courts in particular, surprise is not the word, more vindication of what we've always known to be right. What the Supreme Court held on Monday is that when LGBTQ workers face discrimination in the workplace, that is inherently discrimination because of sex. That you cannot consider a person's sexual orientation or transgender status without consideration of sex. And that is what federal law prohibits and has prohibited since 1964. Now, historically, federal courts for a while were recognizing exactly that in the context of transgender workers. Really, over time, court after court after court had recognized that the discrimination that transgender workers face is sex discrimination. But it was less common for courts to recognize that discrimination on the basis of sexual orientation was sex discrimination, because those courts weren't actually looking at it. They were treating those claims facetiously, because this was often at a time before Lawrence versus Texas, before the marriage cases recognized the equal constitutional protections that LGBT people face and that same-sex couples face for their intimate relationships. But now, with that increasing recognition, when it is no longer constitutional to criminalize same-sex intimacy, when it is no longer permissible to discriminate against the relationships of same-sex couples, the court had to look at the question that was actually posed, which is, was this sex discrimination? And the Supreme Court resoundingly said yes. So that is a tremendous victory that, again, is the culmination of a long time effort to help the courts really address the question here. The ramifications, which was the second part of your question, yes, are really tremendous, because Title VII of the Civil Rights Act of 1964, while applicable only to employment, uses the same prohibition of sex discrimination that we also see in several other federal laws, in the Fair Housing Act, in Title IX, and by reference in Section 1557 of the Affordable Care Act, in the Equal Credit Opportunity Act. So in all of these areas, in the workplace, in your home, in seeking lines of credit from banks, and in seeking health care, the Supreme Court just made clear that sex discrimination, which is prohibited in all of those contexts, includes the discrimination that LGBTQ people face, and that folks should now expect and demand equal treatment in all of those arenas of their lives.
Karen, there's some that say, well, now that we have this decision from the Supreme Court, they're not so sure if passing the Equality Act is necessary. What are your thoughts on that?
I would strongly disagree. Listen, I think that this court decision is huge and really critical, and is going to provide really serious protections to lots of people in lots of their areas of life. But we know two things. One, we know that explicitly calling out discrimination against LGBTQ people in the text of a law has a tremendous preventive effect. We know that where you have a clear message across the board that this discrimination is prohibited, that is heard loud and clear in ways that a court decision should, but the explicit protections are really, really critical. The second thing is that while the existing laws are really comprehensive, they leave out a couple of really critical protections, including most particularly protections in the context of public accommodations. Public accommodations is a fancy word for all of those things that open themselves up to the public and serve people, whether that's restaurants or hotels or retail businesses. There is no present explicit prohibition of sex discrimination in public accommodations at the federal level. And adding that protection is another really critical area that allows LGBTQ people to navigate the world free from discrimination. So I would say we need both.
Thank you, Karen. Diego, PFLAG is the first and largest organization for LGBTQ people, their parents, families, and allies, with 400 chapters and 200,000 members and supporters across the country. What can parents, families, and allies of the LGBTQ community do to help LGBTQ individuals navigate the challenges of COVID-19 and social isolation and other support efforts that are so critical when we talk about the hard work that Karen just alluded to around changing hearts and minds?
Thank you so much, and thank you for letting me be here. First of all, anybody in PFLAG who has one of these has got a leg up on an awful lot of folks, myself included.
For the people that are listening, Diego just flashed his AARP membership card.
Yes, I did. So families everywhere, the thing that all zip codes share is some level of risk for families. During COVID-19 right now, more families are coming together in physical proximity and at least communicative proximity. For some families, that's a great thing. And for others, it puts some of the children who may not be disclosed to their family in a very difficult spot. So for parents who may not know that their children are LGBTQ+, or for grandparents, it makes it extremely difficult from an intergenerational standpoint. So one of the things that we fortunately have done at PFLAG is to make our meetings online. We produced a program called PFLAG Connects, and we provided the paid level of Zoom meetings for all of our chapters across the country. That means that people who are used to doing the part that has to do with support groups can still do that and see faces. The other side of the social isolation part is that the PFLAG meetings are still continuing, but allows people to connect one-on-one as well as in groups. That also involves, though, for people who are senior citizens and everyone else, of course, but prescriptions, medication, access to groceries, that extra hour that some places have provided for seniors to go shopping isn't necessarily an hour that seniors can use. So the intergenerational offerings across families, across neighborhoods, across zip codes is more critical now than ever. And we're seeing that in our chapters.
No, that's great, and thank you for sharing those tips, tools, and resources, Diego. You've also been around and a part of the LGBTQ movement for a very long time. If you could just really briefly just sort of help people to understand the distinction between lived equality and legal equality, I think that would be helpful for our viewers and listeners.
Thank you. And I should have also added on the first part that all of our publications to help families talk to each other are available for free online at our website, pflag.org. So that's a great question about lived equality versus legal. I'll start by saying one thing that's kind of hard to hear. The Civil Rights Act was passed in 1964. And for a lot of people, this year, Juneteenth, was first learned this year. Lived equality is something we're still struggling for, in something that was supposed to have occurred in 1964. As long as people are still in charge of other people, whether it's in employment or access to housing or access to health care, it means that the lived equality has to be supported. Fortunately, we have people like my dear close colleague and friend Karen Loewy to fight those legal battles that we need to bring lived equality closer to the legal protections. But the most important part for us is always to tell our stories. While we have tremendous lawyers like Karen, and including Karen, that do those pretty books with the green covers that go to judges, without the family stories to fill those pages, we're not convincing judges or justices. So for people for whom it's safe, please make sure to tell your stories. That's the part that bridges legal equality, bringing us to lived equality in every zip code.
Thank you for that, Diego. Justin, more than 1,000 corporations filed amicus briefs before the U.S. Supreme Court opposing LGBTQ employment discrimination. Can you share a little bit about what role you expect corporate America to play in helping to enforce our federal legal protections from LGBTQ employment discrimination?
Hello, can you all hear me?
Yes, we can. Justin, you're on.
Thanks. I think we may have a issue getting the camera up, but that's all right. Okay, there we go. It's incredibly important, and for all things that can be said about challenges with corporate America, I think we have to look at the reality that so many companies have weighed in favor of our rights time and time again. And if you think about the long arc of LGBT equality, often the private sector has led the public sector on many issues. The majority of the Fortune 500 had non-discrimination as a part of their policies well before the Supreme Court acted earlier this week. With that said, this is a monumental decision that will ensure that whether you live in New York City or in Montgomery, Alabama, you cannot be fired based on who you are or who you love. And that's incredibly exciting. So, I think the role that corporate America has played, especially in the absence of federal leadership on this issue, administrative leadership on the issues of LGBT equality in the last nearly 4 years now, has been instrumental, and we can't forget that. So I would just say that if you rewind even a short period of time, let's even go back 8 years. Let's go back to the beginning of the Obama administration. There was some tepidness on the part of corporations to get involved and be active on equality issues. That is no longer the issue. In fact, many companies have seen their role as that of end of the spear on these particular issues to really move things forward in the absence of public policy. So, I think we have to keep those things in mind. It certainly means a lot when you see 1,000 of the top employers in the country saying, we think discrimination is bad for business. I think that has a tremendous effect on not only on the case before the Supreme Court, but hopefully in the long term on public policy.
And might I add, AARP Foundation litigation was really proud to be among those that filed an amicus brief opposing LGBTQ employment discrimination. Do you expect support from corporate America to become more or less focused on disparities within the LGBTQ community as we move forward?
I think more. I think until to the previous conversation with Diego around lived equality versus legal equality, I think we still have a long way to go. And that not only is just for LGBT people, but it's for marginalized communities across the board. I think corporate America has a role to play, and not just the role of doing it because it's the right thing. It absolutely is the right thing, but it's also the smart business thing. If you have a workplace that is welcoming, that is open, that is available to everyone to prosper and bring who they are to work, you're not worried about folks' diminished work capacity based on discrimination or fears of being fired or things of that nature. And, I always think that as a social justice activist, the employee that sits in the corner worried about discrimination is a terrible thing. As a business person, that 15 to 25% of the employee's work week that they spend worrying about that impacts the bottom line. So there's not only a moral reason for corporations to participate and continue to lead the way, there's an economic imperative for corporations to do it.
Thank you, Justin. It's now time to address your questions with Karen L. Loewy of Lambda Legal, Justin Nelson of the National LGBTQ Chamber of Commerce, and Diego Miguel Sanchez of PFLAG. Please press *3 at any time on your telephone keypad to be connected with AARP staff to share your questions. We'll also be joined shortly by former Houston Mayor and Victory Fund Institute President Annise Parker, Glenn Magpantay of Incapia, and Dr. Irwin Tan of AARP to answer your coronavirus-related questions and efforts to fight discrimination. I'd like to also introduce my AARP colleague, AARP Foundation Litigation Chief Bill Rivera, to help facilitate your calls. Welcome, Bill.
Thanks, Nick Cordelline. As you noted, AARP Foundation and AARP were among the amici, or friends of the court, who filed a brief in the Supreme Court in support of LGBTQ rights, and really proud of our participation in that case and continued partnership with all of these great organizations here and others who did the same. Happy to be here for this important conversation, and I'm looking forward to questions from our listeners.
Well, thank you, Bill, and thanks for your leadership and the entire Foundation litigation team. Let's take our first question.
Okay, we have Andy from New York with a question.
Andy from New York, you're on. What's your question?
Hi, everybody, and thanks for all your work on this case. I think everybody who worked on the movement for the last 60 years deserves some credit. But my question is about the coronavirus today. I live in New York, where we even have a law that says you've got to collect statistics on LGBT and health services, and we cannot get statistics on LGBT people who have coronavirus or people with HIV who have it. And this is a problem around the country, and I'm just not seeing any statistics, and I'm wondering what you're doing in terms of litigation or advocacy to get us these statistics. I've really seen nothing, especially with HIV, because we want to see how the drugs that they're taking are interacting with the virus.
Thank you, Andy. Karen, you want to take that very important question around data collection?
Sure. I mean, we know data collection is critical for all of the reasons that Andy just highlighted in terms of our ability both to do the public health work and ensure that folks are navigating this epidemic safely for their own medical needs, and also for purposes of ensuring that folks are not encountering discriminatory treatment as they're accessing these critical healthcare services. I know there are continued coalitions and advocacy to ensure that information is being collected. There are not litigation efforts that I'm aware of right now. As Diego was referencing earlier, the downside of litigation is that it isn't always the right tool for ensuring that folks' stories are being heard. But the thing to remember is that you actually need a person who is experiencing discrimination in order to specifically litigate some of these issues. So what I would say is we welcome folks to be contacting our help desk. If they are experiencing these kinds of discrimination, if they are encountering legal obligations that are not being upheld, whether in terms of data collection or in terms of discriminatory treatment of patients. And our help desk can be contacted at lambdalegal.org/help, HELP.
Thank you, Karen. Next question, Bill.
Yes, we have Helen from Memphis on the line.
Helen from Memphis, you're on. What's your question? Helen from Memphis, you're on. What's your question?
Yes, can you hear me?
Yes, we can. Welcome. What's your question?
Okay. I'm so glad that you called me about this town hall meeting. But my question is, what does LGBTQ, what does that mean?
All right. Justin, you want to explain what LGBTQ means?
I'm happy to do so. Hey, Helen, that is for lesbian, gay, bisexual, and transgender Americans, all 16 to 20 million of us, and that includes 1.4 million LGBT-owned companies with a combined economic impact of $1.7 trillion on the U.S. economy, would make us the 10th largest economy in the world, and found in 99% of the counties where we live in this country. So thanks so much for that question.
Thank you. Bill, next question.
Okay, we have Sharita in Washington.
Welcome, Sharika from Washington. What's your question?
Good afternoon, and I applaud this conversation today. But during this COVID, I also have a question in trying to get my mom home, who is in a nursing home, because not being able to see her since March the 16th and her pre-existing conditions. But it's interesting for me to find out that with her having Medicare and Medicaid, that in me trying to get her home, that she will not come home with a hospital bed and I need to purchase one. And I just find that odd, even with her pre-existing conditions, that they are not providing that for her to come home. So any assistance or direction that anyone could give me, I would greatly appreciate it.
Of course. Thank you, Sharika. Karen, where would you direct Sharika?
Great question. Navigating some of these complicated questions around what Medicare and Medicaid will cover and won't cover. Some of that is federal, some of that is state-based in terms of what your state Medicaid program looks like. I would start by having you reach out to your state agency around this, or the Centers for Medicare and Medicaid Services, to get more information. If there are local legal services providers, many of them have put together really great FAQs and information about navigating the COVID pandemic and answering a lot of these questions.
And Sharika, we're going to talk to Dr. Irwin Tan from AARP a little bit later in the call, and so we'll give Dr. Tan an opportunity to add to that. But thank you for your question. Bill, next question.
We have Diane from Brighton, Massachusetts.
Welcome, Diane. From Massachusetts, what's your question?
Well, at the beginning you mentioned about stimulus checks, and I get my mother's mail because she's in a nursing home and I take care of her business. But she received a letter saying that her check had been sent, but I never got it. And I tried calling the number on the letter, but I didn't get anywhere, except I did find out it was supposed to have been sent May 1st. but how do I get it? It seems to have been lost somewhere.
It's a very good question. Karen, where would you direct Diane from Brighton?
It's a great question, and admittedly, outside of my expertise as someone who works in the world specifically of LGBTQ discrimination, I think persistence in following up on every phone number that you're given, every deadline that is set, requires a lot of effort, but is your best route for directly following up on the fact that you have not received the stimulus check that you were supposed to.
And Diane, we're going to flag your question and be sure to share with our colleagues in the ARP Massachusetts State Office. Also, if you and anybody else with a similar situation, if you go to aarp.org/coronavirus, you'll see information there around stimulus payments and additional resources. And so if the folks that are screening could flag that, we'll be sure to get back to Diane from Brighton. Bill, next question.
We have Gloria in Denver.
Gloria from Denver, welcome. What's your question?
Yes, my concern is I care about people who are discriminated against, but I also I'm concerned about many Black people who've been discriminated against for over 400 years. And nobody ever talks about reparations, and I feel it's disgusting.
Thank you for
what has been done to my African American brothers and sisters.
Well, thank you for your comment, Gloria from Denver. Bill, next question.
Okay, we have Mildred in New York.
Mildred from New York, you're on. What's your question?
Well, this country will always be a racist country. Because the white people think they're better than everybody, and they get away with everything. We the last on high, the first flight, and they take away everything for you. Anything they do, they get away with it. That's all I have to say.
Thank you for your comment, Mildred from New York. Bill, what's our next question?
We have Douglas in New York.
Douglas from New York, you're on.
Okay.
What's your question?
My question concerns back what we were talking about, you were talking about earlier with the court decision. You mentioned that a lot of corporations are cooperating and are on board with this, but we also have people who are going to pursue the free exercise of religion clause of the Constitution to try to block the expansion of LGBT rights, just like they did in the case, in particularly with privately held companies, hospitals, and so forth that are held by religious groups that are not tolerant of LGBTQ rights, and they consider it their free exercise of religion to discriminate. What's the strategy? Because I'm sure the experts on the panel know that this is out there, that they're going to pursue this strategy. So what is the strategy for counteracting that?
Karen, can you respond to the outstanding question around religious freedoms and how that factors into the decision? And I'm also going to invite Bill Rivera from our foundation litigation team to also add flesh to that. Karen?
Definitely. It's a very real thing to raise. And actually, in the Supreme Court's majority opinion, they recognize that there are folks who, will try and claim religious objections to ensuring equal treatment of LGBTQ workers. What the court also said, however, is that there are existing principles that strike the right balance in that regard. Title VII itself has an explicit exemption for religious entities to be able to limit their employees to folks of their own religion. But let me be clear, that's it. That's the extent of that exemption. It is not a blank check for folks who may have personal religious objections to discriminate against LGBT workers in the workplace any more than it would allow people with the religious objections to treating Black people. equally in the workplace to do so. This is not, there is no blank check to folks who have religious objections to discriminate against LGBTQ workers in the workplace. That said, these issues are going to continue to arise. And one, the Equality Act is a great response to that in terms of it also explicitly striking a balance between people's deeply held and personal religious practices and people's ability to be their LGBTQ selves in the workplace and have equal access to employment and all of these other protections. The Constitution protects certain kinds of religious expression. It does not invite people to use those to exclude LGBTQ people from public life.
Bill, is there anything you want to add to that in terms of any cases that AARP Foundation litigation might be tracking that relates to the religious freedom question?
I think Karen addressed it very well. There are a lot of complicated questions that arise here, and it is important to remember that the Supreme Court's decision was about the interpretation of a statute. This was not about constitutional rights. And so there are other statutes in play, the Religious Freedom Restoration Act, for example, as well as, as Karen had mentioned earlier, there are so many different places where the term sex appears in federal law that can also be in play. So I do think that it will be a complicated question in many respects. I would agree with Karen that there are also limitations in terms of what religious exercise can include with respect to civil rights laws. And there were certainly individuals and organizations that tried to justify discrimination on the basis of race on some religious grounds, and those have not prevailed. But it's a very complicated and delicate question. We will be following those as well.
Thank you, Bill, and thanks to all of you for your questions. Remember, to ask your question, please press *3 on your telephone keypad. Now, these are difficult times for everyone, and I'd like to give you a brief update on what AARP has been doing to protect older Americans during this pandemic. AARP is focused on 3 key coronavirus-related priorities: transparency and protections for nursing home staff and residents, access to necessary food and nutrition, and support for state and local governments. More than 40,000 COVID-19 fatalities have occurred in our nation's long-term care facilities, accounting for 1 of every 4 reported coronavirus deaths. According to our AARP Maintaining Dignity study, pre-COVID, over 60% of LGBTQ older adults were concerned about neglect, verbal and physical harassment in a long-term care setting, while over 50% were concerned they would be forced to hide or deny their identity. AARP state offices are focusing much of their attention to keep residents and staff safe in these facilities, including requests to improve personal protective equipment, PPE, and increase testing availability, addressing staffing shortages, requiring transparency of facilities with known infections, and increasing access to virtual visitations for residents, such as video chats. AARP's efforts have already resulted in dozens of policy changes. COVID-19 will continue to be a major threat to residents of long-term care facilities for the foreseeable future, and AARP's advocacy is crucial. These efforts and successes would not be possible without the phone calls, emails, and actions from AARP members, volunteers, and older adults across the country. So for that, we say thank you. Now let's hear more from our guest. Glenn Magpantay, Esquire, is the Executive Director of the National Queer Asian Pacific Islander Alliance, NCAPIA, a national federation of Asian American, South Asian, Southeast Asian, and Pacific Islander lesbian, gay, bisexual, and transgender organizations. His efforts were recognized by the Walter and Evelyn Haas Jr. Fund with their 2017 Award for Outstanding LGBTQ Leadership for Immigrant Rights. Before NCAPIA, Glenn was nationally recognized as a civil rights attorney at the Asian American Legal Defense and Education Fund. Annise Parker, Victory Fund and Victory Fund Institute President and CEO, is the first former elected official to lead the organizations, having served 6 years as a Houston City Council member, 6 years as a city controller, and 6 years as mayor of the city. She is one of only 2 women to have been elected mayor and is the only person in Houston history to have held the offices of council member, controller, and mayor. She was the first openly LGBTQ mayor of a major American city. Welcome, Annise Parker. And Dr. Irwin Tan is Director of Health on the AARP Thought Leadership Team. His areas of expertise include geriatric and integrative medicine, health longevity, volunteering, and perceptions of aging. Thank you for joining us today. Let's get started with the discussion. And just a reminder, to ask your questions, please press star 3. Now, Glenn, I imagine that you had a huge sigh of relief when learning about the Title VII U.S. Supreme Court decision on LGBTQ employment discrimination, given the uptick in COVID-19 induced xenophobia in AAPI communities. Does the decision make responding to this COVID-19 crisis easier for your 52 affiliates that are organizing in AAPI communities across the country?
Well, Nii Cordelai, it does and it doesn't, and I'll talk more about that. But first, I really do want to thank Nii Cordelai and AARP for the tremendous support and leadership that they provide in this community. My story about Mr. Nii Cordelai is that he is not only the moderator for this panel, he is the moderator for our movement. But he's a solid moderator, and thank you so much for your service and for your tremendous work. We in CAPIA, the National Queer Asian Pacific Islander Alliance, had a brief in the lawsuit, and we wanted to tell the story of how LGBTQ people of color, how Asian Americans also face discrimination on the basis of sexual orientation and gender identity. Asian Americans are the nation's fastest growing racial minority group. We are the largest segment of immigrants coming to the United States. And yet we still face so many challenges in trying to deal with this. Nii Cordelai, you had mentioned, is it easier? And since the coronavirus hit, since the president called it the China virus, the Wuhan virus, our community has faced attacks and violence across the United States. And it's been so difficult working within this context. We are fighting for our lives to just try to be healthy. And early on, we talked about how it was difficult to cough and to be Asian American in this environment. The decision was a welcome relief for our communities who have faced a history of systemic discrimination for so many years. We tried to show America how 1 in 3 Asian Americans live in states where they can be fired on the basis of their sexual orientation and gender identity. We're so excited about the opinion. But I have to say, the job is not done. As my colleagues at the Lambda Legal Defense Fund talked about, it doesn't cover housing, education, healthcare, public accommodations. And so the victory at the Supreme Court, I'll claim it. I'll take it. We need as many victories as we can win. And unfortunately, there are just so few of them. But the victory says that we can keep your job, but you may not need health care. And as AARP was fighting alongside with us, as more states are opening up, people have jobs and they can go to work, but they can't be healthy and they may lose their health care, and that's a problem. In America today, a gay Black man can go to work and he's discriminated against, but if he has a problem with the police, the problems can really manifest. And the last is that for immigrant workers, H-1B workers, you cannot be fired for being transgender or lesbian or bisexual, but maybe you can be deported. There is so much work that we need to do and so much work that we need to do together. This is a great battle in the victory. A victory in the battle, but not in the war. We have so much to do and so much more to fight for. So it's a great decision. We're excited. We will take this and we will keep working hard and keep fighting for our community. Thank you.
Glenn, just as a follow-up, are there any LGBTQ-related COVID-19 stories that have really stuck with you, or that keep you up late at night these days?
Oh my gosh.
Is there any one particular one that you could share quickly that comes to mind?
Two of them. When COVID-19 hit and Trump called it the Wuhan virus, one of my board members lives in a community where someone came to their home with a machete. I mean, it's incredibly scary. And this is not the first virus that our community has fought. Viruses do not discriminate on the basis of race, sexual orientation, or gender identity. Our communities should not be facing the virus of racism as well.
Thank you for that, Glenn. Mayor Parker, when you were mayor of Houston, you valiantly fought for the Houston Equal Rights Ordinance, also known as the HERO Ordinance. And some might even say that you were ahead of your time. Since then, so many communities across the country have passed LGBTQ non-discrimination ordinances. What impact does this Supreme Court decision have on these valiant efforts?
So I would actually say that Houston was behind every other major city rather than ahead, in that Houston remains the only major city in America that has no local non-discrimination protections of any kind. And our ordinance was a comprehensive ordinance. It wasn't specific to the LGBTQ community. What is so interesting, and has already been touched on in the previous comments, is that this is a great win because work is the key to everything. Work being where you can support yourself, you put food on the table, you can support your family, but it is not the only place where we need protections, and there are still, of course, gaps. What Victory Institute, I run two organizations, Victory Fund and Victory Institute. Victory Institute, we don't do lobbying, we don't do policy. What we do is we work with elected officials, LGBTQ elected officials, and help them do the legislation that is most impactful in their communities. And what we know is that even with the ruling on employment, as discussed, there's still gaps in public accommodations. But our elected officials are going out every day fighting to prevent conversion therapy, fighting to allow LGBT couples to be able to adopt, fighting against so-called religious freedom exemptions, fighting for something so basic as bathroom access. And those fights are still going to continue. The other point I want to make is that federal legislation, and why local ordinances are so important, and why I'm so glad that the movement for local ordinances is continuing. You know, if you're old enough, everybody's heard the phrase, well, don't make a federal case out of it. If there is no local non-discrimination policy protection law, all you have is the federal court. By having local non-discrimination policies, you have a local resource so that something can be dealt with, often in a non-judicial setting, very quickly and efficiently, and you can go on down with your life. But without those local protections, all we have is the federal level. And as we have seen over the last few years, rights that we thought we had secured can be unraveled depending on who's in the White House.
Just to follow up, Mayor Parker, what are you hearing from Victory Fund Institute's vast network of out-elected and appointed officials about the continued efforts to change hearts and minds to enforce LGBTQ non-discrimination protections?
There are more than 850 out-serving LGBT elected officials. Actually, there are more than 850 running this year. There's a lot of people in the pipeline and the process. And the first thing I will say, simply the act of standing up and saying, I am who I am, and I deserve full human respect, makes a difference. But then once one is in office and has the power to enact legislation, our officials roll up their sleeves and get to work. Obviously not the only issues that they work on. What we find is there's an issue of being present. When you have one openly LGBTQ elected official, it doesn't stop bad bills, but it slows them down. It changes the conversation in the chamber. When you have three, it pretty much, it stops things. When you have more than that, when you have 5 or 6 or 7 or enough for a caucus, and I'm particularly talking about state legislatures right now, you actually can do positive legislation. Because what happens, bad legislation metastasizes from state to state. Good legislation can do the same thing. And so what we work for is to hope that our elected officials are able to pass best practice legislation, and then they share that information and they move on. But we still see, as I said, the different types of anti-LGBT bills that aren't touched at all by this federal legislation, and that won't really be touched by things like protections in public accommodations, the conversion therapy, the bathroom access bills, really the adoption, anti-adoption bills, all still needing to be worked on. But hearts and minds are changed when people know us. So it's that being who we are everywhere we can be, so that people can get to know us and understand us. It's a lot harder to look at someone across a conference table and say, I'm going to discriminate against you, than to do it to an anonymous person.
Thank you for that, Mayor Parker. Dr. Irwin Tan. Dr. Tan, you and I have talked at length about your medical training and residency in my home area, the San Francisco Bay Area, during the early years of the HIV/AIDS pandemic and how it shaped your perspective on public health. How did the HIV/AIDS epidemic shape your perspective as an ally and gerontologist?
Nicolai, thank you so much for letting me join you here today on what is an important conversation. While I myself am a medical doctor, I'm not an expert in COVID-19, but as a physician with fellowship training in geriatric medicine at UCSF, which is a medical school in San Francisco, I saw how important it is for people to come together. From my time working in geriatrics in the 1990s, I can say is that no one is going to be able to get through this alone, but we can come together, and that's why we're here on this call today as LGBT people and as allies. One of our many concerns I have, which I saw back in the 1990s, is the mental health of our nation and the stress and isolation that occurs in many marginalized and disenfranchised communities. It's completely normal to feel sad, anxiety, and stress during this COVID-19 pandemic. But what we're seeing from data collected by the Census Bureau and released by the CDCs is that up to a third of Americans are now experiencing symptoms of anxiety and depression. And those are important issues. On top of that, people are becoming increasingly socially isolated. There was a recent scientific report that was sponsored by the AARP Foundation that was done by the National Academies of Science and Medicine that elevates social isolation and loneliness to the level of mental health problems. And it actually increases your risk of early death from all causes. Some people say it's as bad as smoking 15 cigarettes a day. And social isolation is even more common in the LGBTQ community. And with this novel coronavirus, we're seeing that this can make the problem worse. We also know that even after the murders of George Floyd and others that within the African American community, that stress and anxiety are rising even more so. And we know that, for example, specifically in the Black transgender community, that many people have been affected by racism and violence as well. So one of the things I would like to just applaud is the work of PFLAG, because it's important now that we come together both as families, both families of birth and families of choice. And we saw this in the HIV/AIDS epidemic. the importance of communities coming together to provide mutual support. And what we like to use is the term physically distant, because even though you may need to be physically distant, for example, I didn't see my own mom for 4 months, we can still be socially connected. And I think that's important. The other piece I would just add is that, there have been a lot of questions about specifics. And at this time of this outbreak, ARP is trying to provide information and resources to help older people and their families to protect themselves and their households against the virus. So what I would say is that a great resource is, and as you mentioned, Nikolai, arp.org/coronavirus. And I think that there's, a lot of information from that deals with general and specific questions, and that's a great resource to always go back to.
And quickly, Dr. Tan, can you share what might other gerontologists learn from COVID-19 that might better equip them to serve the LGBTQ community?
I think the specific issue is, identifying not only families of birth, but families of choice who, and actually asking people, there's, are they in a relationship, and is it with men, women, or both? I think that those are very essential questions that we should be, as physicians, very comfortable with and asking. I think that it's really, we talk about transparency in a data collection sense, in that relationship between a provider and a patient. Those are important questions to be able to help people identify what resources they have and also identify who is at risk within their own family.
Now, before we return to your questions, I want to take a moment to tell our viewers and listeners about a really exciting tool AARP has developed to ensure that we stay connected and in community. Sometimes hearing a friendly voice can help in challenging times. AARP Community Connections, a toll-free service for all adults 18 and older, has trained volunteers standing by to provide a friendly call and say hello. If you would like to speak with someone Monday through Friday, 9 a.m. to 5 p.m. Eastern, call 888-281-0145. That's 888-281-0145, and leave us your information. A volunteer will call you back, and if you prefer, you can set up a recurring call, say every Wednesday at 2 p.m. for a check-in. Again, this is a free service for all adults, regardless of membership, and we do offer some bilingual capabilities, including Spanish. That number again is 888-281-0145. You can also go to aarpcommunityconnections.org. Now let's hear more from our experts through our Q&A. Bill, it's time to address some of the questions here from the folks listening. Bill, do you have any callers for us?
We sure do. I have Evelyn in Atlanta.
Evelyn in Atlanta, you are on with us. What's your question?
My question is why statistics said that more African Americans dying from this disease than any other ethnic group?
Sure. Thank you, Evelyn. Erwin, can you take that? Why are more African Americans dying from COVID-19?
There are a lot of reasons, and I think many of them can be boiled down to issues of racism and institutionalized, discrimination that's occurred across generations. We know that many times the jobs that people have been allowed to have in the past, the homes that people have been allowed to purchase in the past, have been limited by racism. And we are seeing more and more that African American workers often are in what we call essential jobs, where people don't have the luxury of working from a distance, but actually have to be in the community where they are potentially at more risk. The other concern we have is also housing, that due to housing costs and historical racist policies such as redlining, people have often live in in larger households, and there's more potential spread within those households as well. These are some of the issues that we've discussed both at arp.org/coronavirus or at our ARP Public Policy Institute blog site, Thinking Policy. And I think the important piece is we do have also advices. What can we do within our houses, within our households, to try to protect each other, but also from an advocacy issue.
Erwin, we're going to come back to you because Erwin, your sound has decreased a little bit, but we're going to go to the next question.
Okay.
Bill, next question.
All right, we have Lula in Washington.
Lula in Washington, welcome, Lula. What's your question?
I wanted to know, AARP usually fill out my income tax. Now that the libraries are closed, where is the nearest place I could get them filled out by AARP?
I'm actually going to ask Bill, if Bill Rivera, who is our ARP Foundation litigation chief, if he might have a response to that question, being that our ARP Foundation has a terrific tax aid program where they help people with their taxes. Anywhere to direct her, Bill, or any information on that?
Sure, appreciate that. Obviously, we had to make some changes with the pandemic. We have moved to open some additional sites depending on local conditions. You can go online to aarpfoundation.org and look for the tax aid site on that page. You can also call 1-888-227-7669. Again, that's 1-888-227-7669, which will show you what sites may be open, and hopefully others will be opening as states open a bit. But we also do have some online assistance as well. And again, I would direct you to our website at aarpfoundation.org.
All right, Bill, next question.
Okay, we've got Elaine from Scranton.
Elaine from Scranton, you are on. What's your question?
Can you hear me?
Yes, we can. We can hear you.
Okay, I have two questions. One is regarding the Supreme Court decision. I wanted to know if it applies only to employers or if it applies to services being provided by businesses, if they are still allowed to discriminate against customers. And my second question is regarding the coronavirus. I wanted to know if face shields are as effective as masks, as the face shields that are the clear coverings that cover your entire face, if they work as well.
Great. Thank you for that question, Elaine. I'm going to ask Glenn to answer the first part of that question related to the SCOTUS case and its application to employers, or whether or not that also applies to customers. Glenn?
Sure. And, I'm an attorney by training, a civil rights lawyer by practice, and the decision is specific to employment-based discrimination. So an employer cannot fire you on the basis of being lesbian, gay, bisexual, or transgender in the same way that they cannot fire you on the basis of your gender, race, ethnicity, disability, etc. It does not cover public accommodations. It does not cover services. And so if a restaurant does not want you to eat there with your same-sex partner because you are queer, you have to leave. And there will be no federal protection. Now, the waiters can still be gay or bisexual or transgender. They cannot be fired, but the customers can. So we still have a lot more work to do. We are not done with this fight.
And Annise, if you want to weigh in on exactly why the Equality Act is so important and how it might be a remedy for the scenario that Glenn just laid out.
Well, other than now with the Supreme Court ruling on employment, which is nationwide, we have a patchwork of protections across the country. And the Equality Act will have one standard and will address a lot of these issues. It won't address all of them, but it will definitely address most of them, and it will allow us to have a measure of safety as we move across the country, state to state.
And I want to just point out that last year, on the 50th anniversary of the Stonewall Uprising to the day, AARP publicly endorsed the Equality Act. And so we hope that work gets done. Dr. Tan, can you answer the second part of Elaine's question related to face shields and masks? And I know we've been following the CDC guidance, but can you shed some light on the question around face shields versus masks and where people can go for more information on that?
So people can go for more information again at aarp.org/coronavirus. And the current recommendation is that face masks, even a cloth mask, can both help protect yourself and help protect others. Some people have been using the plastic shields, and that's a conversation that's occurring, but there's no current guidelines on those plastic shields. But there's no evidence that they would hurt either. But definitely I would recommend using a face mask, especially if you're in an indoor location and you're not able to physically distance. And many localities are now requiring that as well.
Thank you, Dr. Tan. Bill, next question.
Okay, we have Ira from my hometown of Brooklyn.
Mm-hmm. Ira from Brooklyn, welcome. What's your question?
Yeah, well, I'm mainly going to make a comment.
Okay.
Because we're in the midst of the greatest uprising since the Detroit Ghetto Rebellion of 1967, a multiracial uprising against racist police terror. And I don't understand how, while I completely support equal rights for LGBTQ community, I don't understand how that preempts, in the midst of this massive, unprecedented anti-racist rebellion, a discussion by AARP on the issue of racism, and it goes way, way beyond police terror. The African, the Black Americans, Black working class Americans are grossly discriminated on an economic basis in the workplace. They have job classifications that were created to fill these jobs with African Americans at low wage rates so that they could maximize their profits for corporations. It's been estimated by some legitimate sources that 1/3 of the profits made by Wall Street come from lower pay to African, to Black working class people. And if you add in Latinos and some Asian workers who are grossly discriminated as well, it could be almost half the profits they make come from these racist schemes. To me, we have not taken major strides.
Thank you for that. Thank you for that comment, Ira from Brooklyn. Glenn, I'm not sure if you want to shed some light on that. The only thing I would add is that the fight for civil rights is inclusive of all of our civil rights, and I think sometimes when people think of the LGBTQ community, they don't necessarily think of everybody under the rainbow. Black, Latino, AAPI, etc. But Glenn, would you like to shed some light on Ira's remarks?
Ira, all I want to say is amen. I agree. The decision that we won at the Supreme Court does not address racial discrimination in America, does not curtail the killing of unarmed Black men and boys in this country. We have so much to do. We have so much to fight for. We are not done. We will claim this victory. This victory is ours because it is one step closer to the justice and freedoms that all communities deserve, but it is not the freedom that we all need. And so thank you for raising this issue. I agree with you, and that is why my organization, the Victory Fund, PFLAG, and AARP are working together to fight race-based discrimination, discrimination on the basis of gender, sexual orientation, gender identity in America today. Thank you for your comment.
Thank you, Glenn. Bill, next question.
Okay, we have Ethelene from Davenport.
Ethelene from Davenport, you're on. What's your question?
Well, I haven't put it together nicely as a question, but I'm a black woman in Davenport who's been put on the Civil Rights Commission just this month, and I'm blessed to have had you call me today to share the intelligent conversation of so many people who have information that I'm not aware of. Once I hang up the phone, who do I go to? How do I keep these issues and these concerns in my knowledge base? I'll be asked to put together a visionary statement, and I'm all the closer to being able to do that by listening to what's been said. But I don't know once I hang this phone up just where to go.
Thank you for that question and comment, Ethelene. I want to invite Mayor Parker to shed some light on that. I know the Victory Fund Institute has a vast network of out LGBTQ elected and appointed officials across the country. There may be somebody close to you in Davenport that the Victory Fund Institute might be able to connect you with. But Mayor Parker, please shed some light.
Actually, I think all of the organizations that are represented on this call today, and again, thanks to AARP for bringing us together, we all work on these issues on a regular and routine basis. At Victory, we work with elected officials, so they're in the room making things happen. And I appreciate that you said that you were on you're on a commission or some sort of a human relations group. I would assume you have a responsibility and an opportunity to elevate the conversations and the problems that you see to either an elected official or a body that can take action. What I would encourage you to do is to check out all of our organizations, but most importantly, find the resources in your community. And certainly if you contact me through victoryinstitute.org, I'm happy to try to connect you with any of our local resources on the ground. But I know all of the organizations on the call today will help you do that. The way we get through these big challenges is by listening to each other and sharing our lives with each other so that we can work together on the solutions. Thanks for volunteering.
Remind everyone to press *3 at any time on your telephone keypad to be connected with AARP staff to share your question. Bill, next question.
We have Robert from Louisville.
Robert from Louisville, you are on. What is your question?
My question concerns the economic discrimination that people of color face, and AARP is unable to do anything about it in terms of the services, what we pay for services such as the homeowner's insurance and automobile insurance. With the automobile insurance, it's 4 times what I pay 4 times as much as someone in another zip code pays, and 3 times as much for my homeowner's insurance. And when I looked at the advertisement that AARP send me, there's no difference. If you live in a zip code they identify as predominantly black, you're charged 3 to 4 times or more. And so, is anything being done to deal with this economic disparity? Research shows that just to be black, it costs you $3 to $4 million more to live the same life.
Thank you for your comment, Robert, from Louisville, and we'll be sure to flag your question and connect you with our ARP staff in our Kentucky state office, as well as folks in our DC national office that track and work on consumer protection issues on behalf of our members. So thank you for that. Bill, do you have another question for us?
Sure. I would also note in response to the last caller that AARP has been expanding and developing work across the country under what we call Disrupt Disparities, which is really trying to look at socioeconomic issues and disparities by race, ethnicity, and so on. So I think our state office, national offices could also help direct you to some more specific information on that. But colleagues around the country really are taking to heart the kinds of disparities that you have identified. So look forward to the follow-up on that. We have Arit in Los Angeles next.
As an Eris? Eris in Los Angeles? Welcome, Eris from Los Angeles. What's your question?
Okay, yes, my question is, the situation because of the COVID virus, I really need assistance, that is financial assistance, paying my rent, my utilities, because, I cannot work. I have a medical, pre-existing medical conditions. I'm diabetic. I'm hypertensive. I take insulin. And, I've been very sick. And I just want to know if there's a way I can get help with my rent and my utility bills, and then see if we can get the second stimulus checks they've been talking about. So my question is now, how do I get help to help myself? Because I live by myself in a small one-bedroom apartment. I've just turned 66 on Tuesday, June 16th.
Mm-hmm.
So I don't have family here. So how can I get help for myself?
Thank you for your question, Eris. I'm going to first go to Dr. Irwin Tan to highlight any particular resources that we can connect you to. And then I also want to invite Bill Rivera from our AARP Foundation. There's a lot of work with folks that may be lower income, folks that may be socially isolated. And so first, Dr. Tan, where would you direct Eris for a little bit more support where she might learn about rental assistance programs, among other things?
This is a story that we've heard throughout the country. A lot of people are in need of a lot of assistance, and the particulars of each state are different. I think that the best source we have for up-to-date information remains our website for aarp.org/coronavirus, and they will have advice on how one can make sure that you've gotten your check, and also at the state level there might be some resources as well to talk about particulars of your location. But unfortunately, that's the best one I can give you right now.
And Bill, was there anything that you want to quickly add?
Sure. AARP Foundation can try to connect you with some resources. You can look again at our website, aarpfoundation.org. We have different resources that we can connect you to there, including Connect to Effect, which has a website to connect to effect.org. But I think the main website is probably, at least if you have web access, your best bet to start. You could also contact us at 800-775-6776. Again, 800-775-6776, and we can try to direct you to some resources that may be helpful.
Thank you for that. And thank you to our distinguished panel, Glenn Magpantay, Esquire, Mayor Annise Parker, and Dr. Irwin Tan. This has been an informative and very important conversation. Thanks to each of you for answering our questions and your unwavering commitment to ensuring that LGBTQ older adults are central to your efforts. Before we close, I want to invite AARP Foundation Litigation Chief Bill Rivera to share a final thought. Bill?
Thanks, Nicordelai, and I really appreciate your leading this thoughtful and informative conversation today. On Monday, 3 individuals changed our world: Gerald Bostock, Amy Stevens, and Donald Zarda. We thank them and their advocates for their courage and persistence. As Margaret Mead said, never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. At AARP and AARP Foundation, we are proud to have played at least a small role in Monday's victory against employment discrimination by joining several other great organizations to file an amicus or friend of the court brief at the Supreme Court in these cases. There are approximately 900,000 AARP members who self-identify as LGBT, making us one of the largest LGBT constituencies of any U.S. organization with a membership. And as we noted in our Supreme Court brief, 1 in 5 older LGBT adults reported recent involuntary job loss due to, at least in part, to their perceived sexual orientation or gender identity. And older LGBT workers postpone retirement at a higher rate than the general population, likely due to a lifetime of economic disadvantage. We also cited to AARP's Maintaining Dignity research to note that LGBT respondents show high levels of concern about challenges as they age, including access to quality health care, long-term care, housing, and other social supports, which is consistent with what our experts talked about today. We believe that we should enforce vigorously the fundamental right of all people to be free from discrimination, and that we should eliminate practices that target specific groups or communities for exploitation. We will continue to use all of our advocacy tools, including litigating in the courts, to drive systemic change for older adults, especially the most vulnerable. We are very interested in learning more about barriers to economic opportunity and social connectedness, especially at the intersection of age and other characteristics, including race, ethnicity, disability, and sex, including LGBTQ identification. We'd love to hear your story. You can visit us at aarpfoundation.org. You can contact us at litigation@aarp.org. Thank you, Nicolai.
Thank you, Bill, and thank you to these incredible leaders, incredible national leaders, Annise Parker of the Victory Fund Institute, Karen L. Loewy of Lambda Legal, Glenn Magpantay of the National Queer Asian Pacific Islander Alliance, Diego Miguel Sanchez from PFLAG, Justin Nelson from the National LGBTQ Chamber of Commerce, and of course AARP's very own Dr. Irwin Tan of our Thought Leadership Team, and you just heard from Bill Rivera, our AARP Foundation Litigation Chief. These folks are incredible, and thank you for being so generous with your time and your information. Of course, thank you to our AARP members and volunteers and listeners for participating in this discussion. AARP, a nonprofit, nonpartisan member organization, has been working to promote the health and well-being of older Americans for more than 60 years. In the face of this crisis, we're facing information and resources to help older adults and those caring for them protect themselves from the virus, prevent its spread to others while taking care of themselves. All of the resources referenced, including a recording of today's Q&A event, can be found at aarp.org/coronavirus on June 21st. Again, that web address is aarp.org/coronavirus. LGBTQ older adults and seniors can also find LGBTQ tips, tools, and resources and benefits at aarp.org/pride. That's aarp.org/pride. We hope you learned something that can help keep you and your loved ones healthy. Thank you. Stay well, stay lifted, and happy Pride. This concludes our call.